Hi everyone, this is our weekly blog, and today I thought I'd talk about NNT values on various kinds of heart procedures. Now, NNT means the number needed to treat. It's a research term. It tells us how effective a drug really is. Number needed to treat. In other words, how many people do we have to give the drug to for a particular problem for one person to be cured or fixed of that problem? For instance, the NNT value for any broad-based antibiotic is 1.1. That means for every 1.1 persons given an antibiotic who have a bacterial infection, one person is cured of the infection. That's a pretty good drug. That's about a 98% success rate. Okay? But it's interesting to look at NNT values for cardiac procedures or cardiac drugs like high blood pressure medications. And this information is available easily to you if you look for it. And it's truly astonishing to actually look at this stuff. Okay, let's take the benefits from taking high blood pressure medications. And let's examine high blood pressure medication for how successful it is to prevent death from a heart attack and strokes. Okay? And you have to take the blood pressure medication for at least 5 years. So let's say we're loaded up on blood pressure medication. It's never just one medication. It's usually 3, a beta blocker, an ACE inhibitor or a channel blocker, and then a diuretic. Okay, so it's either lisinopril, hydrochlorothiazide, and metoprolol, or amlodipine. Okay, this is a compilation of all studies that have been done everywhere up until about 2015, okay? And here's how many people were benefited. These are how many people were saved from a future cardiovascular event by taking antihypertensives. 1 in 125 were prevented from dying. So that's less than 1% were prevented from dying. 1 in 67 were benefited from having a stroke. 1 in 67. So what's that? That's less than 2%. It's like 1.5%. And 1 in 100 were prevented from having a heart attack. So that's 1%. So 1% were saved from a future heart attack. 1.5% were saved from a future stroke. And 0.8% were prevented from dying. This should be a real eye-opener for you. Hypertensive medication doesn't work in preventing cardiovascular events in the future. Isn't it astonishing? And yet everybody's taking high blood pressure medication. Yeah? I find this amazing. And the best number was 1.5% were prevented from having a stroke, which kind of makes sense because you have a lot of pressure in a vessel, in the tubes. If there's a lot of pressure, the vessel can break, right? Which would be a stroke if it occurs in the small capillaries in the brain. That was 1.5%. Can you imagine? Everybody's on high blood pressure medication, and yet it's a joke. I mean, 1 in 100, 1 in 67, 1 in 125. And these are double-blind tests, okay? All right, let's take beta blockers. Now, beta blockers are your metoprolol, your propranolol,